A lot of lower back pain and hip pain and knee pain can be caused by overactivity of the quadratus lumborum muscles, the psoas muscles, and even the diaphragm, particularly on the left. So a squat is a great technique to help tone down that muscular overactivity, but it has to be done in a very specific way, and it has to be thought of in a very different way. And that is what this video is about. First, how should you think of the squat? What you don't want to think of the squat, for therapeutic reasons, you don't want to think of the squat as a gym exercise. In fact, doing a gym squat and a normal, natural human squat that you find humans all over the world doing, although not in Western countries anymore, are vastly different things, and that's why the therapeutic benefits don't really go with gym squats. They go with natural, normal human squats. You have to think of a squat, a natural human squat. It's not a gym exercise. It's not a biomechanical exercise either. It is a brain, sensory, respiratory position movement. You have to think about what the brain is sensing and how you're breathing before your mechanics will allow you to squat normally. The squat might be the most misunderstood exercise that exists, probably because it's not really an exercise. The gym squat, where you put a barbell on your back, that is an exercise. However, normal human squatting, a normal natural human squat, has nothing to do with the gym. It's a movement, but it's also a rest position, but it's also a relationship to the ground in which your body has to descend, go down towards the ground, but that cannot be done for a lot of people because their backs are too tight, their hamstrings are too tight, their calves are too tight, or they're too unstable. So when you are on 2 feet at a time and you're doing a squat, there's 2 different ways that one may do it. One is a natural human squat where it requires thoracic flexion. Your back is completely rounded, while the other, your back is extended. That's more of a gym squat. A gym squat is not great for helping with pain simply because it's putting you into extended position. Your body's going into extension. Extension is fight or flight. Extension is tension. If that's the only way you squat, you might need to actually be able to do a natural human squat to help inhibit that tension and to restore diaphragmatic breathing and a sense of grounding. The primary differences between the 2 squats, in the gym squat, which I will call the extension squat, because that's really how it's taught. At least it was when I was studying for my strength and conditioning. It was still taught to arch your back, flare your ribs, to tighten up everything, including your lats, which is really horribly wrong for health. Nonetheless, these things are all done to stabilize your spine and take a big breath of air, intra-abdominal pressure, which brings all movement to a stop for the most part, and then bend your knees and go down. Now, what is that going to do? For the vast majority of people who, again, are not Olympic lifters, that's probably going to tilt your pelvis forward on one or both sides. That will then arch your back on one or both sides. That is extension. That is the position of the body that causes people pain. And that is what, in postural restoration, we are simply trying to get people out of that position. The other problem with that is it takes away diaphragmatic breathing. We call it a PEC pattern in postural restoration. When one or both sides of the pelvis is stuck forward, which you might call an anterior pelvic tilt. I don't call it that because the whole body is tilted, it's not just the pelvis. And when your ribs are flared on one or both sides, your back is overarched, that disengages your diaphragms, and that is the problem. There are a few muscles that we do not want to have overly engaged, your psoas muscle and your QL muscles. A lot of people know about these muscles simply because they hurt. No one should know that they have a QL muscle, and the only time they know they have a QL muscle is when they're in pain and they go looking for it. And then they say, oh, you got to stretch it, and it's involved in all these pelvic tilt issues. Well, that's all true. They are involved in all of these things, and they do hurt and they do cause problems when they're overactive, along with the psoas. But as I've shown in so many videos, the psoas has nothing to do, it's not a stretchable muscle. It's a muscle that you need to inhibit or reduce its overactivity, but you don't do it through stretching. And the real reason is because that psoas is attached to a diaphragm. And what you're going to see in some of these images, here's the psoas and the diaphragm. You cannot separate those 2 muscles. The psoas inserts into the diaphragm on both sides. So if the diaphragm is not in a dome shape, meaning it cannot pump. It's kind of stuck a little bit flatter, which is what happens when you when you arch your back and flare your ribs. You're tightening up your diaphragms, which means you tighten up your psoas muscle. And then the QLs also attach to the diaphragms. And this is what it would look like on top. But notice also, so this is looking down, you have a left diaphragm and a right diaphragm, and they are not symmetrical. They're not, those are two different muscles. They are not the same. So even when you're squatting down and you think everything is, balanced, you're really not, because there's more core muscle. If you want to think of the diaphragm as a core muscle, you have more core muscle on the right side. Those diaphragms attach to your lumbar spine. So when you flare your ribs and you arch your back, as it does that, you rotate more to the right. You're gonna be more to the right because you do not arch equally, because you're not symmetrical. Now, so many people have lower back pain right in this region of the 12th rib and at the thoracolumbar junction at T12 and L1, L2, L3, L4, 5. Again, because of this asymmetry, your spine gets pulled forward when you're too extended, and this will start to rotate your spine more to the right than to the left, but then you have to start to twist to stay straight. So you're not ever going to squat symmetrically. However, you can inhibit the asymmetry by biasing your left side, by sensing your left heel and the arch of your right foot, which I will get into when I actually talk about the technique that will show you a better way to actually help you squat. So the number one reason people can't actually get into a squat position all the way down is because their back's too tight. They can't get air into the back of their rib cage. They're extended. And when they try to go down, they can't do it because their back is too tight. And so what do they have to do? They have to widen their stance. They'll go with their legs really, really wide, and that will give them more ability to go down. But again, that's the problem there, is that's going to help tip the pelvis forward, because as you move your femurs away or outside, that's destabilizing your pelvis. So what are you going to use? You're going to use your lower back and probably your pelvic floor muscles to try to help stabilize things, and your QLs and your psoas. So at that thoracolumbar junction, what you're going to see is, again, everything looks symmetrical. The iliacus, the psoas, the QL, the pelvic floor muscles, they seem symmetrical. However, because of the bigger right diaphragm, and again, there's the bigger right diaphragm, when you superimpose the bigger right diaphragm on top of this area, there's no way that your ribs and your pelvis are going to be in a symmetrical position. They're not. And on the right side, where you see exhaled state, the ribs on the right probably are not going to be flared as much. That's why it's the left rib flare is ubiquitous. Sometimes you do see a right rib flare, and then that's kind of problematic because you have to think, well, that's not normal. That's not the normal position for a right dominant human because of this asymmetry. The right rib cage will usually be in a more compressed state, and the left rib cage, which is an exhaled state, the left rib cage is more in an inhaled state with the ribs flared up. It's more decompressed. So as you descend into the squat, if your back is arched, there's no chance that these muscles are all going to be used the way they're supposed to be used, which is not a lot. They're going to be overactive, and that is going to inhibit or decrease your ability to get deep into a squat, unless, again, you start to play with the form and move your legs out lower, or move your legs out further so that you can get down. If you liked this video and you thought it was interesting, can you like it, comment, or subscribe? Appreciate it. Thanks. So this video is just a simple video of PRI testing to test whether a rib cage is flared on both sides and the spine is extended, and whether the pelvis is forward on one or both sides, or whether this individual is neutral. So as you watch this video, the testing is going to show that he is extended. Pelvis is forward on both sides and ribs are up. Okay, so just watch. This is how we determine what happens. So this individual, his right leg will not adduct, which means that right pelvis is forward, which blocks the ability to adduct. Also on the left, if the right side is forward, the left side is definitely going to be forward because of this asymmetry. His right shoulder does not internally rotate, and his right shoulder will also not internally rotate, which means his ribs are flared on both sides. So he's bilaterally extended. He cannot squat. And if he did, it would cause a lot of problems. So now I'm just going to have him blow up a balloon. I'm just going to fix his position. I put him on his left sit bone, so he favors his left diaphragm. I put him into a state of, he's in a squat position, but his back is flexed. Of course, the car alarm goes off in the video. But he's sensing his left sit bone. He takes a breath into his back. I felt it expand. I knew I didn't even have to have him blow into the balloon, but I did anyway. And then I'm going to retest him. And you're going to see that he can now pass all of his tests. So he is now neutral. Now that's just a starting point. He now needs to build stability with hamstrings and adductors and glutes. But that got his body into a neutral state. With one breath with the left diaphragm, all those biomechanical tests changed. He was in a squat position. He was in kind of a half squat position. So we can use squatting to change these tests. But a lot of people are not going to do well going all the way down. So you put them in more of a half squat position, and I'm going to show that in the technique that I actually show at the end. Now, as I said, you're squatting in an environment. When I squat, I can squat outside perfectly well in the wide open space. My brain likes wide open space. Put me in a narrow room in a small gym, which is where the picture of me squatting, the gym squat, actually both squats, were taking place. I don't squat as well because my body is still tense. That's not a biomechanical issue. That's a tension issue because my brain, I'm farsighted. In a small room, my brain thinks like everything's collapsing on me and it tenses up. Put me outside, I can squat no problem. So environment. Watch what happens to my friend. He's a dance teacher. He's going to be completely neutral, PRI neutral. He has full abduction of his right leg. He will have adduction of his pelvis. So his pelvis is neutral already because he's a dance teacher. Dancing is the best. It keeps you neutral. He's lacking right shoulder internal rotation the smallest amount. But now I put him in one particular area of his dance studio and he's tightening up. That is because he's too familiar with that environment. I made a whole video about this. You can watch it. I'm not going to go into it. But just notice he is tightening up when I put him in this one area of the dance studio. So this is not superfluous. This is not out there. This is how it is. You are moving in an environment and the environment will influence you. Now, some people are not going to do well with a squat and some people really shouldn't squat. And we call them generally pathological, meaning they have too much range of motion. Quite often, they have straight leg raises of, way past 90 degrees. They can palm the floor. Now you say, what's wrong with that? Well, nothing's necessarily wrong with it if their pelvis is in a neutral state. But generally what they're coming in as is they have a pelvis forward on one or both sides, and their back is, their ribcage, their spine is extended. You really shouldn't have that much range of motion. And also, one of the problems is a lot of these times people will come in with more of a forward head posture. They've lost the curve in their neck. So in this picture, you see a straight neck, and the other picture, unfortunately, they're not facing the same direction, but then you see a normal curve. If you have a straight neck, you'll have an increased lordosis in your lower back. So that's what you see. In that position, your back should be tight. If your back is tight, you shouldn't be able to palm the floor. You shouldn't be able to squat all the way down with your legs close. But yet, sometimes they still can. So how have they accomplished that? Well, they probably stretch things out in ways that destabilize their body. So if you're hypermobile or you're very, very flexible, I'm going to show one version of the squat technique, and that's the one you would want to do. If you are not hypermobile, you're not going to know whether your neck has a good curve to it or not. But if you're not hypermobile, you're just kind of normal. I don't want to say normal, but you're not hypermobile, then you can go all the way down in that squat. Okay, so the most important thing when we do this squat is that you are grounded through your left heel and you're sensing the arch of your right foot, and your legs are close together. You want to get your knees as close together as you can get them for internal rotation of the femurs. Otherwise, you can't get your pelvis into a posterior tilt effectively. And you need air to expand the back of your rib cage. So I'm going to show you how I do it. And I'm hanging onto a Smith machine. And I'm going to start off in a quarter squat. Now I am feeling my abs and I'm feeling my hamstrings already. That's the key. Hamstrings and abs are the key to doing an effective squat without doing it pathologically. Now I just go a little bit lower, and I'm still breathing into my back. I'm getting air into my back, and then I go all the way down. Now, it would be better if if the Smith machine could go a little bit lower, so my hands were lower, but I can't get that. But again, I'm sensing my left heel, I'm expanding my back with air, and I'm just breathing, and I still feel my abdominal muscles. Now, I'm moving my head around. Why? Because I don't want my neck to tense up. And when necks tense, everything tenses. And I would even speak or sing or do something in this position to keep my vocal cords resonating. If the vocal cords resonate, your body will probably stay pretty relaxed because your vocal cords and your pelvic floor are very interconnected through breathing. And then you can go back up again. So that's what you would do. You would stay in each position. You could stay for 5 breaths, or you could just do one position at a time. You don't have to go continuously down. But the objective is you breathe it, you get into whatever position, and you take a breath in through your nose. Feel your back expand, exhale through your mouth. You want to get all your air out. Pause for a few seconds before you take another breath in, sensing left heel and right arch the entire time. Now, someone who is hypermobile would likely not want to go all the way down. They'd want to stop more in this position because if they go low, they're going to kick in their hip flexors because their pelvis is too unstable. So you start them off in a more of a quarter squat position. The pelvis is going to posteriorly rotate. The knees have to move forward. For a true squat to occur, knees have to move forward because the ankles have to dorsiflex. And again, you're just trying to breathe into your back. But again, if you're hypermobile, some people are not going to be able to go down all the way without kicking in their hip flexors or their back extent. They would be their hip flexors. Now that's a problem. And why is that a problem if they do that? It's because they're going to then disengage their diaphragms. Because if the hip flexors tighten up or become overengaged, that will tighten up the diaphragms. So it's interesting, the left diaphragm, we want the left diaphragm to pump, but when the back is arched, the left diaphragm becomes more flattened and tense, and thus on the left side, the diaphragm often acts more as a postural stabilizer, and that's why people will often get mid-back pain on the left side. It's probably because the diaphragm, because they're in this position, their pelvis is forward on one side, on the left generally, and then the left lower back is overarched, and in that position, left hip flexors get overactive, left QL gets overactive, and left diaphragm flattens instead of retaining a dome shape, and now you lose your ability to breathe with your left diaphragm, and now you get stuck more on your right side.